We're here with Mark Bell to go over his lab work here. We have a recent blood work panel.
I didn't agree to this. What the hell's going on
Now
here?
we're violating all sorts of... Yeah. So Mark has tried various diets, as you all know, over the years. Low carb, keto, carnivore, bodybuilding style diet. For those of you that don't know, he has bench pressed, has a lot of records and accolades in powerlifting, Olympic lifting, bench pressed 854 pounds, squatted over 1,000 pounds, deadlifted well over 700 pounds. So very impressive guy. We worked out yesterday with Sean Baker.
That was amazing,
yeah. Yeah, and so we're just here. We're going to go over his labs. And so, Mark, you redid these in June. So we have two different labs, and we'll share these on the screen here. We just want to talk about some patterns and trends, especially after doing a relatively high carbohydrate diet for, 5 months now?
Yeah, very high carb and specifically high simple sugars.
Yeah.
And I actually was kind of like blasting them on purpose to sort of see what I would get with my blood work. And just so people know, I've been doing this diet for about the last 6 months, and more specifically, a little bit more of the simple sugars in the last 3 months since I had this test done.
So let's first, and many of you who follow, our channel, know this. We talk about the metabolic triad. We want to look at hemoglobin, A1C, insulin, glucose, and liver enzymes, and then triglycerides. So the metabolic stuff, the liver, and then the fats in the blood, the triglycerides. And so first, let's look at the metabolic health. And so we're going to look at the glucose, insulin, and hemoglobin A1C. Glucose here, 87 milligrams per deciliter. Totally normal. I would not suspect even mainlining sugar.
The weird thing with that is that is very similar to my numbers on a very low carbohydrate diet.
Yeah.
I think my numbers have been like around 90. I think they've been around 85 and 82 and stuff like that in previous. Unfortunately, here today, we don't have some previous labs, but maybe I can share that with you and you can make some comments about that in a future video as well or something like that.
Yeah, that'd be interesting. So let's go down to your insulin. This is the most surprising to me. So you've been consuming a lot of high glycemic index, refined, if you will, carbohydrates.
I mean, literally, I'm pouring sugar into smoothies, like actual sugar, taking a box of sugar and dumping sugar into smoothies.
So Mark's fasting insulin is 3.9 units per ml, which I would have suspected it'd be 12, 14. So that's really impressive. And so I think that speaks to the amount of lean mass you have, the exercise that you've been doing, and then
that's important to note. Yeah, all the lifting I've been doing over the years is playing into this. This isn't just so people could have much different results if their liver isn't healthy, if they're if they have a different body composition, but potentially they could get a similar result, perhaps.
For sure. So that's really interesting. We're going to look at the hemoglobin A1C momentarily, but let's talk about the liver since you mentioned that. So as you all know, we have 3 liver function tests that we look at in blood work. We have the AST, ALT, and GGT. And so right here, if there was hepatic fat buildup, non-alcoholic steatohepatitis or NASH, we would expect your GGT to start to increase. And at 36 international units per liter, the ideal range, Mark, just if it was 25, it'd be perfect. You're a little bit higher than what would be considered optimal, but considering the fact you've been having a lot of sugar, I'm relatively impressed, to be frank with you. So,
and I think it's worth noting that we were just talking before we recorded, and I do plan on consuming a little bit less sugar.
Yeah.
I'm going to replace some of those sugars with more starches, and that should lead to less overall carbohydrate consumption due to the satiety of like rice and potatoes and so forth.
Yeah. Okay. So that would be interesting to see what that changes and what your historic levels are when it comes to your GGT. There's some hormones that we're skipping over, but we're going to come back to. So because we addressed GGT, we should probably also address AST and ALT. These are the other 2 aforementioned liver enzymes. Now, the thing about AST that folks should understand, and you as well, Mark, AST is not specific to the liver. It's categorized as a liver function test, but AST is also released from the heart if there's cardiovascular stress. So in your case, it is a little bit on the higher side at 63 international units per liter. So that's something that might warrant potentially a coronary artery calcium score, CTA, if you will, to just maybe look at and see where that is coming from. And the ALT is elevated as well. So it's about double of what we would want. This isn't alarming, but it's something to consider. So you may want to get a ultrasound of your liver just for good measure, just to see if anything changes. I wouldn't suspect that this is related to the sugar diet. because
this is very common with my blood work that these are
elevated.
I have had, and we'll talk about it maybe in some other video down the road. I have not released this information, but I have had a coronary calcium score. Is that what they're called?
Yeah. Mm-hmm.
I've had 2 of them over the years, and they're not awesome.
Okay.
The results aren't awesome.
Yeah.
Yeah.
So this could be a little bit of cardiac stress, more specifically, not hepatic stress. So just something to keep in mind. And it could be playing around with the primobolan and just going on straight testosterone. So anabolics, you're not shy about, your use with those. Those can, the hormones are going through the liver. And so it's just a little bit more stress on the liver. So we don't know where the stress is coming from. It could be cardiovascular. It could be a little bit of the liver from exogenous hormone use. So just something to keep in mind.
And I am aware that I do have plaque. I had 2 coronary calcium scans done. They were done about 3 years apart. One of the things that's interesting about them is the first test was just like kind of a little bit more of a normal test. The second test that was done was from a company called Clearly, and Clearly uses some form of AI to speculate, I guess, further information about the type of plaque that you have. And that was showing that I was like in some remission of some of the more dangerous plaques. Obviously, you don't want any plaque,
right?
But it was showing that I was in remission of some of the more dangerous plaques. I have taken some measures outside of that. It was actually part of a study, as part of a test that a friend of mine did. It was like, an actual clinical trial to try to reduce those plaques. And that first test was not effective, but I do have calcification here with the carotid artery. And then I think they also check the groin. At least maybe they were checking my groin for no reason. I never even thought about that. But, so anyway, they checked that stuff out. And yes, I do have some calcification. I don't know if it's directly from steroid usage, but it could be, because I never had a scan done beforehand when I was 20 years old or 25 years old or anything like that. So I don't really know. But so some people might think, well, Mark's an idiot. Why is he moving forward but still utilizing performance-enhancing drugs? I agree that they don't help, but at least in accordance to the information I have right now, it doesn't seem like there's much of a protocol. And I understand that steroids don't help the situation, but there's not much of a protocol to get rid of plaque.
Right.
There's really doesn't seem to be a medicine or medication. I know there's stuff for your lipids, and there's statins, and people have conjecture about keeping your certain levels really low, but my ApoB, as you look at this test, is very low. It's 65. So anyway, all that just to try to make people aware a little bit more of my medical history. I've not really talked about that openly, and the reason why I haven't talking about it openly is not because I'm trying to hide anything from anybody. I just don't like to communicate about stuff that I don't have a good solution for.
Totally.
So hey, I got my calcium, and it's hi.
So what do we do now?
And I don't even know what to do about it, because diet and exercise, better is always better. Diet and exercise, they probably help, but at least so far, there's not any studies, I don't think, that are showing that they're reversing. And maybe more than me on some of that.
It's hard. There is some research on statins. People will cite that. Mainstream. There's not a lot of good therapies that we have evidence on. People talk about proteolytic enzymes, serrapeptidase, trypsin, chymotrypsin. These systemic enzymes on an empty stomach might possibly help. But I'm in the camp of stand-efforting that the body is constantly changing, malleable, and so forth. And one way we can reduce the shear stress on your arterial system is possibly donating blood.
Right.
So when we look to your CBC, so I know we're kind of moving gears a little bit. I don't want to bounce around too much, but it's pertinent to what we're talking about here. Reducing the factors that may exacerbate or worsen coronary artery atherosclerosis and carotid artery atherosclerosis is reducing the shear stress in the body. So we flip to the CBC with differential here. And so what we see, these are your white blood cells and red blood cells, and we want to look for the indicators of increased blood thickness or viscosity. And that is part of the atherogenic potential problem with any anabolics, whether it's HRT or exogenous steroid use or whatever, is one of the benefits, and this is how anabolics were discovered in AIDS patients, is they would increase and ameliorate anemias in people with AIDS, right? Or other wasting conditions. And so by increasing erythropoietin, which is helpful in athletic contexts to
The
a certain
APO,
point. So what happens here, Mark, as we look at your labs, your hematocrit is 49%. So if you were racing in the Tour de France, you're 0.9% away from being disqualified because your hematocrit is high. And this is common in men, whether or not they are on PEDs or not.
Sometimes it's just a sleep situation, right? People sleep apnea.
Yeah. It could be as simple as dehydration, but I think you're pretty aware that is hydration.
This has been a fluctuating thing constantly for me.
Hematocrit,
and I've donated blood and stuff like that before. So it looks like I should probably do so again.
I would recommend that. Yeah. I think it's just a prophylactic measure. Right. If you're on TRT, HRT, PEDs should donate blood because it does increase viscosity. There's not going to be a performance detriment because you don't live at altitude.
Right.
And so I would suggest that.
Simple. And the range here isn't like crazy. It's just
slightly,
high.
A little high.
Yep.
Yeah.
Gotcha.
And when you think about what does that mean, that just means that your blood is prone to becoming more thick or viscous. And blood is what's known as a non-Newtonian fluid. It can have like circulatory, like a eddy within your, and that can create shear stress on the arterial system.
I do want to mention that my blood pressure isn't high. So a lot of times it's the combination of the blood pressure being high and your blood being thick.
Yeah.
That's a real, kind of kiss of death, so to speak.
Yeah. So we look at the hemoglobin, hematocrit, and the RBC, and then ferritin and iron. And so just your hematocrit is on the higher side. Not alarming. Every 6 months, just donate blood. I'm sure you've probably been told that before.
I've done that before, and I like donating blood.
Yeah. No, it makes you feel good.
Yeah.
So let's skip over to lipids. Okay. We want to look at triglycerides, whether or not someone is eating a lot of sugar or not. We want to look at, that's a good marker of metabolic health. 63 milligrams per deciliter. I would have marked, I thought they'd be over 100. So I'm impressed, man.
I do also want to point out, I think it's worth noting that, I used to be 330 pounds.
Yeah.
So untangling this web of my health is very difficult because, I abused anabolic steroids for many years while I was competing in powerlifting, and I was well over 300 pounds for at least 5 or 6 years. So there's a lot of things that I did years and years ago and had a ton of like sleep apnea and stuff like that I'm still like almost like healing from, basically.
100%.
And so I think that's
good content.
That's something worth noting. And then also, I've cleaned my blood work up so much from that time. I might even have an old blood test result, or actually can view it on my YouTube channel, which is, I think it's on the Super Training 06 channel. I had Stan Efferding reading my labs, mainly probably 10 or 12 years ago. And those labs were horrific. The triglycerides and the glucose and a lot of it. And that wasn't even at my peak, unhealthiness. So anyway, I just bring that up to say that not only do I get my blood work done, I am doing my best kind of in accordance to what I can do, what are the controllables that I have,
awesome.
Aside from just playing around with a little performance enhancing drugs.
Yeah, no, it's really good context. And I'm glad you mentioned that because the way that I look at health is sort of how I look at financial debt. If being at 300 pounds, sleep apnea, all that, having periods of being overweight or whatever, a lot of us have been there. That is sort of like a financial debt. It's like a high interest loan that you're slowly paying off. And so we need to consider that in the context of where our health is at too. And so you're chipping away at that high interest loan, which is good. And that's being reflective in your blood work. Your triglycerides are only 63 milligrams per deciliter. Your VLDL, which is related to insulin resistance, is quite low at just 14 milligrams per deciliter. So that's impressive. The one thing that I would like to see you increase is your HDL and your ApoA1. So as many people know,
and even my just overall cholesterol, right? It was
they're pretty low.
My overall cholesterol is 110.
Yeah,
or something, right?
It's 110. Exactly.
Yeah, so I was gonna try to fix some of that with eating some shrimp and stuff like that because it has some cholesterol in there, and I will, up my fats a little bit to try to help with the markers of health here.
Yeah. That could just be a function of being on a very low fat diet.
Right.
It'd be interesting to see. That can drive down both LDL and HDL. But we know that just looking at LDL and HDL is not really specific or sensitive, and that's why we look at the ApoB to A1 ratio. So every particle of LDL and VLDL and remnant lipoprotein will have an ApoB, apolipoprotein B associated with that. And HDL has a varying degree, 1 to 4 different ApoA1 molecules associated with it. So what we want to look at, Mark, is the ratio. Ideally, the ApoB to A1 ratio would be 0.5. Yours is closer to 1, not super alarming, not very uncommon. There's a lot of people with that. I would rather see, but here's what's cool is your ApoA1 is higher than your ApoB. That's great. So doing things to increase your HDL, like you're running, you did have an injury. So it kind of makes sense you're not running as much.
I think actually that's why some of like a little bit of the inflammatory markers on here are a little bit elevated, because like this pain in my heel has been so constant. Yeah. I don't know. I mean, I'm sure people listening know what that's like to have like a chronic pain, and it just feels like, it feels so stressful on you. It's like you brush it off here and there, but it is really like a stressor. Oh,
for sure. Yeah. You mentioned inflammation. So let's look at your CRP. So your C-reactive protein, it's, as many of you know, this is a generalized marker of inflammation. It's not specific to any one region of the body, but it's 1.3 milligrams per liter. Ideally, this would be like 0.2, 0.5. So it's slightly elevated. I've seen it way higher.
I've had it at like 12.
Yeah, exactly. Yeah, this really can go really high.
Yeah. They're like, what the hell did you do? I was like, I don't know.
Yeah. So not alarming, but just something to keep track of. But again, if you have a soft tissue injury, that's going to cause non-specific inflammation. So the CRP would increase. So, and this is an acute phase reactant. You can't, make sweeping inferences off one piece of labs anyway. So even if it was 12, would we freak out about it? No, we want to retest. You could have been sick that day.
I'm actually going to get more blood work done probably in about 6 or 8 weeks from now too, to see if some of the changes, some of the things that I'm already implementing now, see what kind of changes can occur.
Okay, good. So your homocysteine is a little bit elevated, not alarming. We talked about TMG, and even creatine is involved in methylation.
I haven't been taking creatine, so I'll have to hit you up.
Yeah, maybe like a B complex and creatine might be helpful. Your vitamin D is nice, at 49 nanograms per ml. That's perfect. Right around 50 to 60 is ideal. So, and you don't take vitamin D, but you're in the sun a lot. And you live in Sacramento.
And I also, for this test specifically, a friend of mine, David Herrera, who knows a lot about like the sun and vitamin D and stuff like that, he said, do your best to, be 3 or 4 months natty, going into like a vitamin D test. So I wanted to get it like tested in this way. And I have been getting a lot more sunlight, but this test was done, about a month ago or so, maybe a month and a half. So it's like the UV and stuff like that wasn't quite as high as it is now. So maybe my vitamin D went up even from there. But probably. I think that we're learning more about vitamin D, and I think that vitamin D is supposed to go up and go down.
Oh, for sure. Yeah, it'll fluctuate seasonally. Yeah. But you're doing a good job naturally, so that's cool. The other markers here, you have antibodies that are detectable to your thyroid. But the hemoglobin A1C is at 5.4%. That's great.
Could be better though, right? Could be down to around 5.0, 5.1.
I don't worry about it.
Nitpicky. Okay.
Yeah, honestly, I don't, because there's actually a better marker called 1,5-AG. So A1C is going to give you like 90-day average, 60, 90-day average. 1,5-AG is more 2-week average.
Maybe you can email me a couple things that I should get tested.
Yeah,
I'll definitely I don't use email.
I'll text you. No, I'll text you some of that stuff. We did address on the other podcast that we filmed DHEA. So what's interesting is, Mark, you might notice, I'll share with you guys, your testosterone levels are amazing, free and total, fantastic, but your DHEA is low. And this is an important hormone for the brain and immune system. So we want to prioritize DHEA. So the cool thing about this is an over-the-counter, generally regarded as safe, GRAS supplement. I would start out at 50 milligrams at night.
I do think that there's something else at play here, is that cholesterol, DHA, vitamin D, steroid hormones, I think all those things work really well together with some fats.
Yeah.
And so I do need to probably increase some of my fats, which this is stuff I already knew. Again, this was like just an experiment.
Right.
I was trying to run and trying to do it strictly so I could really see what's going to happen. But I think if I increase my dietary fats a little bit, I think all these markers will improve a little bit.
Yeah. No, I agree.
And I just mean like, I'm just going to move it up like just a pinch. I don't think I need to move it up. Like I don't need to like triple my fats or anything, but
yeah. What's nice is your sex hormone binding globulin is quite low, and that speaks to the fact that you have pretty high free testosterone. So whatever you're doing there is awesome, or it could just be a natural thing for you.
I think that's it's always a little lower, yeah.
How it is, which is good. Some men, this is like sky high. It's weird. Everyone's a little bit different. Now your ferritin is in the midline of the lab range, which this is your stored iron. So donating blood would not be problematic for you.
Okay.
You wouldn't have to worry about becoming anemic, which I wasn't concerned about that to begin with. But yeah, this is curious to go back and look at your historical thyroid peroxidase antibody levels, see if they've increased or decreased, or if you just hover around 17. Anytime someone has an antibody to a tissue, this is friendly fire. Your immune system is reacting to your thyroid for some reason. Just see if this changes over time. And that would be curious. Okay. We talked about your LP little a, lipoprotein little a at 45. This is largely genetically, but also dietary determined. It'd be interesting to see when you increase the fat, how LP little a changes. So that's that. Reverse T3, a little bit higher than we like to see. You could benefit from thyroid glandular supplements, but it's not alarmingly high. But porcine.
Those aren't, I mean, you can get some over the counter. I think you make a product, right?
Yeah.
But then you can also get some prescribed as well, right?
Armor Thyroid.
Okay.
There's Westhroid and Armor. It's porcine and bovine thyroid. And part of that is the glandular aspect of it does help the gland itself, but there's also a little bit of free hormone in there as well. Okay. Let's see. What else do we really want to address? Oh, your p-tau protein seems to be a little bit higher. And so this is a newly characterized way to look at the brain health over time and susceptibility to Alzheimer's and dementia. It would be curious to see what your ApoE4 genotype is. Do you know that by chance?
I don't know that. And I don't think I've ever had this test done before either. So this is the first time I've ever had this pop up. And again, I think that potentially this is maybe skewed by just me, like really going super low on fat.
For sure. And a lot of people are starting to look at p-tau 217. Really, it's new. So this is probably why you haven't had it before. And, there's some speculation about how sensitive or specific it is, but just to be aware that it is higher than the standard deviation of the population. So you just want to see how your diet and lifestyle affect that.
Right.
And then, I don't think Alzheimer's runs in your family.
No.
So just something to be aware of and just track it over time. And then also, because it is elevated, you want to see if you're an ApoE4 genotype. So we have 4 different alleles or variants of the ApoE4 gene. We get one allele or one copy from mom, one from dad. The 4 allele tends to confer higher susceptibility to developing dementia and Alzheimer's.
Gotcha.
It's not deterministic, but it just means that potentially, minimizing exposure to heavy metals and all of sleep is really important, all those things. So keep that in mind. Your BUN is on the lower side. So this is known as your blood urea nitrogen. That's the acronym, what BUN means. And so that is on the lower side. We would want to look for your EGFR.
My creatine is like almost always high.
That's your lean muscle mass. So the creatinine, a lot of people think that that's related to creatine consumption. It's not. It's a reflection of ammonia or nitrogen breakdown in the body. So the protein that you eat and the amount of lean muscle mass you had. Remember when I said, I was like, hey, you're probably 1.2. Like you're 1.25. So muscular men will have a higher creatinine. And so that can skew this ratio, the relative proportion of BUN to creatinine, because your creatinine is higher. That's going to skew that ratio. But we just want to look at your kidney function. I think there's nothing to be alarming about. Your EGFR is 71. So your kidney's flowing good and filtering properly. But your BUN is on the lower side. Could just be genetically. Some people just have numbers that are a little bit different from the average person. But most importantly, Mark, the most ominous marker that we look at, the marker that can signify changes in the body in a negative way, is albumin, and yours is above 4. So oftentimes we see albumin drop, and I've seen this in cancer patients and other clients that I've worked with. The albumin's like 1 or 1.5, and they become hospitalized and they become really sick.
Wow, I didn't know that.
Yeah, so your albumin actually speaks volumes of overall health, and your albumin is over 4, which is great.
Why do you think that it's rare to see bodybuilders have cancer? Just
exercise,
blowing through carbohydrates all the time, or blowing through glucose all the time.
And
I'm not saying that they can't get it
for sure,
but
it's often cardiovascular disease. No,
right.
I think there's so much about muscle and exercise that is protective that they are decreasing the prevalence of cancer by doing that. Yeah. But it seems that they would be doing everything to foster a neoplastic environment with HGH and insulin and all the carbs and all the shit. But muscle is such an important endocrine organ when stimulated. I think it just, the signaling molecules from moving muscle often confers protection. Yeah.
Cool.
Okay. So your TSH is up here. It was 3.3, slightly elevated, not alarming.
Right.
I wouldn't worry. I mean, now, TSH is a pituitary hormone. It can increase because you need iodine. So oftentimes, because the thyroid stimulating hormone actually causes your cells to increase what's called the sodium iodide symporter or transport protein. So it can increase to get more iodine. So oftentimes when it's increased, we just give people more iodine. It can also mean that your thyroid hormones are out of whack, but you're free in total. T4 and T3 are not.
And my understanding is you can get some iodine naturally through some seafood, right?
Totally.
Yeah.
Yeah.
So that's what I kind of plan to do, or at least start with that.
Yeah. And iodine's cheap too.
Yeah.
As a supplement. So, well, thanks for being vulnerable and open enough to share your labs like this. This is really cool. Yeah.
I appreciate you, going through it all. And I think it's important to get this information out there. I think, I don't know why, people get obsessed with this stuff and they want to see it. I don't know if it's because they want to burn me at the stake if something bad goes wrong, or if they want to be like, oh, now I'm going to do the diet because Mark had some pretty good result. In either case, I don't think anyone should they shouldn't base only my experience off of, off of anything. I do understand how they could be influenced, especially because I am posting pictures and I'm flexing and shit like that. And I'm doing that to show and to document my own progress.
Yeah.
I'm not really just trying to say you're going to have the same progress or you're going to have the same results. I try to always backtrack as much as I can and try to give you as much information. I do A, B, and C, and D is how I'm getting these kind of results or conclusions. So I do like being transparent and try to be open and just show people what I'm doing, how I'm doing it.
Yeah, that's awesome. That's the way to do it. And just some small changes, just to recap that, donating blood. And then we want to look at how incrementally increasing little fat could possibly increase your HDL. And then dig a little bit deeper into the ALT and AST, see why they're elevated, and see how donating blood once every 6 months will drop your hemoglobin and hematocrit, and if that changes over time, calcification, But I think overall you're doing a good job.
Thank you. I did start to take a little bit of supplement. I took a B vitamin that has some TMG in it, has the glycine in it, and then I also am taking TUDCA, which is a liver supplement, and that same product has choline in it.
Oh, nice.
So all those things should be, should help the liver, and I think I'm taking something else that has something to, kind of boost the kidneys and stuff. Not because I saw anything here that was alarming, but those things are kind of absent from my diet as well. The choline, especially because it comes from a egg yolk type thing. So
right.
I just wanted to supplement a little bit of those things and kind of see what the results will be next time.
For sure. NAC and glycine and acetylcysteine at night would be helpful potentially. And then DHEA at night. I would consider that. These are really affordable supplements too.
Great.
Awesome.
Thank you.
Yeah, thanks for coming on.
Thank you.